Washington state legalized medical cannabis in 1998. Recreational stores are not required to be endorsed for medical sales. An endorsed store must have medical cannabis consultants on staff, have DOH-approved product available for sale, and must be able to enter qualified patients in the medical cannabis registry. 420-friendly has been endorsed since 2016. There are 12 qualifying conditions that have been identified by the state of Washington where patients may benefit from the medical use of cannabis products. Intractable pain is a severe, persistent pain that is resistant to conventional treatment methods. Some potential causes of intractable pain include chronic nerve damage, complex regional pain syndrome, fibromyalgia, cancer pain, and phantom limb pain. Intractable pain is a qualifying condition for obtaining a medical cannabis authorization in Washington state. This allows patients to legally possess and purchase cannabis for medical use, including for managing symptoms related to intractable pain and its treatment. The Washington DOH oversees a voluntary medical cannabis registry. Patients can get a medical cannabis card from a medically endorsed retail store after receiving a qualifying authorization from a healthcare provider. Registration offers benefits such as excise and sales tax exemption on medical compliant products. A link to our video on how the database works and what you need to know about the benefits of having an authorization will be featured at the end of this video, or you can find it under the playlist Medical Cannabis. The program allows a qualifying patient to name a designated provider to purchase and/or grow cannabis on their behalf. Designated providers must also be registered and hold a recognition card. Cannabis may help with intractable pain by activating cannabinoid receptors in the brain and nervous system, which can reduce pain signals and inflammation. Specific compounds, like THC and CBD, interact with these receptors to modulate the body's pain response and activate pain-blocking pathways. While research is ongoing, studies suggest cannabis can offer benefits for neuropathic and chronic pain, potentially reducing the emotional and sensory aspects of pain and improving overall function. How cannabis helps manage pain. Cannabis contains cannabinoids like THC and CBD, which are chemically similar to the body's own endocannabinoids. These cannabinoids interact with the endocannabinoid system, a network of receptors throughout the brain and body that regulates many important functions, including pain. Blocks pain signals. By activating cannabinoid receptors, cannabis can prevent nerve endings from releasing certain chemicals and reduce the sensitivity of nerve cells to pain signals. Reduces inflammation. Cannabinoids have anti-inflammatory properties that can help to reduce low-grade inflammation associated with certain types of pain, such as neuropathic pain. Activates pain-blocking pathways. Cannabis can activate descending pain-blocking pathways in the nervous system, further contributing to pain relief. It is crucial for patients to have an open, non-judgmental conversation with their care team about cannabis use. This ensures they are aware of potential drug interactions and safety concerns. Because state and federal laws on cannabis differ, it is important to understand the regulations in your location. Research on terpenes for intractable pain is developing, with studies suggesting that specific compounds can offer anti-inflammatory, analgesic, and neuroprotective effects. Limonene. Abundant in citrus peels, limonene has anti-inflammatory and antioxidant properties that may help alleviate inflammatory and nerve pain. Its mood-elevating and stress-reducing qualities can also indirectly benefit those with chronic pain. Examples of strains high in limonene include Kush, Jack Herer, Super Lemon Haze, Cinex, and Wedding Cake. Beta-caryophyllene. Found in black pepper, cloves, and rosemary, this terpene is a non-psychoactive cannabinoid that directly activates the CB2 receptor in the endocannabinoid system. By doing so, it can reduce inflammation and pain without the psychoactive effects associated with CB1 receptor activation. Recent research has shown its promise for treating chronic inflammatory conditions like arthritis and diabetic peripheral neuropathy. Examples of strains high in beta-caryophyllene include Bubba Kush, Sour Diesel, Gelato, Chemdog, Death Star, and GG4. Linalool. Present in lavender and mint, linalool is known for its calming, anti-anxiety, and sedative effects, which can be beneficial for those with chronic pain. Its analgesic properties are linked to its ability to modulate pain perception in the brain and interact with the central nervous system through mechanisms that involve glutamate, opioid, and adenosine pathways. Examples of strains high in linalool include Do-Si-Dos, Lavender, Skittles, Grand-Daddy Purple, and Amnesia Haze. Myrcene. One of the most abundant terpenes in cannabis, myrcene is also found in mangoes and lemongrass. It is recognized for its analgesic, sedative, and muscle relaxant properties, which can help with pain, inflammation, and sleep disturbances. Some studies suggest it acts peripherally to inhibit pain perception, potentially by modulating the release of inflammatory chemicals. Examples of strains high in myrcene include Blue Dream, Grand-Daddy Purple, Grape Ape, White Widow, and Tangy. Pinene. Found in pine needles, rosemary, and basil, pinene comes in two forms, alpha and beta, both offering anti-inflammatory and pain-relieving benefits. Alpha-pinene is also noted for enhancing alertness and potentially counteracting the short-term memory impairment sometimes caused by THC. Its pain-relieving action is partially mediated by suppressing inflammatory compounds. Examples of strains high in pinene include Dutch Treat, Blue Dream, Jack Herer, Harlequin, and Lemon Sour Diesel. Humulene. Also found in hops, humulene exhibits anti-inflammatory and analgesic effects similar to NSAIDs by inhibiting pain-causing pathways. Examples of strains high in humulene are Death Star, Sour Diesel, Dog Walker OG, GG4, and Headband. THC, tetrahydrocannabinol, and CBD, cannabidiol, are the primary cannabinoids studied and used for intractable pain, though other cannabinoids like CBG and CBN are also being investigated for their potential pain-relieving effects. More research, including human trials, is needed to fully understand the endocannabinoid system, phytocannabinoids, terpenes and flavonoids, their effects, benefits, and optimal usage. How they all work together and in what combinations. While progress is being made, it is important to always consult your doctor before using cannabis to treat any medical conditions, as it may interact with other drugs, particularly those affecting the central nervous system or metabolized by the liver. It is known that certain cannabinoids may enhance the effects of blood thinners and sedatives, and it could potentially alter the effectiveness of antidepressants and immune modulators. Thank you for joining us. We hope this information has been helpful and that you'll join us as we continue to explore the potential benefits of this amazing plant. Please hit that like and subscribe button and leave us a comment and let us know if there are any other topics you'd like us to cover. Until next time. Peace.